Good evening, everyone. I'm Kim Fuller, and welcome to the HR for Health webinar, COVID-19 August update, FDA approval, vaccine declination, and more. As you guys know, changes to COVID-19 vaccination and testing requirements are in full effect. So we'll be covering a lot of things tonight. Who handles the expense for employees being tested, navigating medical and religious exceptions, maintaining COVID-19 vaccine documentations. We've got a lot to get through. Thankfully, we have Ali Aramchian, the co-founder and CEO of HR for Health, presenting for you this evening. If you have questions, feel free to put them in the question box. We'll do our best to get to them. And now, I know there's lots to do, so I'll turn it over to Ali.
All right. Thank you, Kim. Thank you very much. Welcome, everybody. You know, we have a packed audience tonight and excited to have you all here. As most of you know, I'm Ali Aramchian, I'm a dental and medical attorney and also the CEO of HR for Health. And you know, this is a very trying time for us, you know, and it feels like deja vu, if you will, because there are massive changes happening to COVID vaccination and testing requirements. And I know that this is a highly charged and political topic, and we have received hundreds, if not, you know, close to thousands of emails and text messages and phone calls ever since we even, you know, published that we were going to do this seminar tonight, because of the fact that, well, there's a lot of confusion out there, and more importantly, there's a lot of information that may or may not, you know, be correct. And I know a lot of you are confused by that. So our goal tonight is to kind of go through all those things. The things we're not going to talk about is we're not going to talk about the pros and cons of, you know, vaccinations. We're not going to talk about, you know, research topics about whether it helps, you know, defeat COVID or not. And we're definitely not getting into conspiracy theories. We're not doing any of those things. And I appreciate all the communication you guys have sent about all those things. But tonight, we're really going to just focus on a couple of things, which is, what are your obligations as an employer? What are your obligations, you know, as a dentist, veterinarian, optometrist in practice to your patients? What do you have to do, you know, with regard to these new COVID rules? And it's important to remember that this Delta variant and some of the other variants that are coming out, you know, seem to be, you know, although obviously they're in the same family as COVID, they seem to be a whole new disease, right? They seem to be a whole new disease because they are attacking people who we previously thought were not susceptible to getting COVID, you know, whether it's young people or you know, people who, you know, are vaccinated, you know, are getting through it. We're hearing more and more of people who are getting breakthrough, positive, positive accounts of being, you know, positive for COVID-19. And so it's becoming much more consistent now than ever before. And so depending on your state, you know, you might be required to do a handful of different things. So you might be required to maintain vaccination documentations for your employees. You might be required to begin testing for your employees. You know, some states have different rules, some cities have different rules. So we're going to go through a lot of that tonight. And with the recent FDA approval of the Pfizer vaccine, what we're going to see more and more states and localities coming up with more rules regarding vaccinations and testing. I mean, this is something that is happening in real time. Just today, we had another state come up with new vaccine rules. And so this is a sort of a very, you know, fluid thing, and it's going to change consistently over the next, I'm sure, several weeks to months, unless we get control over the spread of this Delta variant and maybe all of COVID overall. So these are the issues we're going to deal with tonight, or these are the issues we're going to talk about tonight. And we're going to talk about the new policies, medical and religious exemptions. We're going to talk about new hires, what you do there with them, because a lot of you are hiring, you know, either new employees or employees that are replacing employees that may be on leave. So we're going to go through all of that. And that's the main reason for tonight's seminar. Of course, I know we're not going to be able to touch on everything. And so if you have questions, please put them into the question box. here. If we don't get to them tonight, we will certainly get back to you. So make sure we have, some sort of communication from you, your email or whatnot, so we know how to get a hold of you. So now this information that we are bringing to you is not legal advice, of course. Although I am a lawyer, it's not legal advice. It's really guidance more so than anything else. And what's important to remember is that this is fluid, as I mentioned. So things are changing rapidly. And so keep that in mind. And it's important that you stay in touch with us. You look for our social media posts, you look for our articles. If you're an HR for Health customer, you're going to have all this in our newsletters and other things that we do for you specifically. So keep an eye on all of this. And if it is confusing, which it is, make sure you reach out to us with any clarifying questions. So here's what we're going to talk about and we're going to cover tonight. We're going to talk about requiring the COVID-19 vaccinations as a condition of employment, and how do you handle hiring, okay? We're going to talk about who handles the expense for an employee when they're being tested. We're going to talk about how do you navigate the medical and religious exemptions, okay? So we're going to go into some detail about that. And then how do you maintain the COVID-19 documentation, and what do you need to do to be compliant with that? Because as what happened in March of 2020, states are putting out these rules where documentation is absolutely key. I mean, this is a big part of it. It's not just about the vaccine or whatnot. Now, as an employer, you have all of these extra requirements that you must maintain this documentation. And so it's vital that you know about this. Now, who is this person? You guys remember? Some of us might be aging ourselves, right? Anybody guessing? So yes, that's right. It's Tina Turner. It's Tina Turner. And why do I put her picture up there? To burn the fact that Tina really stands for there is no alternative, right? There is no alternative anymore regarding documentation of your HR requirements. Now, in 2020, when March happened and we all closed down, you guys saw all the requirements that came out of that, between the PPEs and the PPP loans and everything else that became an absolute requirement. This has now become even more of an issue with all these new rules that are being put out by the states. And remember, their goal, right, the state's goal right now is they're treating, the Delta variant as a whole new disease, really, because all the things that they did, last year as far as masking and all the PPE stuff, although it's still in place, they are regarding those as not being enough anymore, right? They're saying that's not enough to defeat this variant. Hence, they're having the vaccination requirements, the testing requirements, and so on and so forth. And part of that, of course, is documentation. They have to have documentation to be able to pressure you as an employer, rightly or wrongly. Again, remember, we're not making any judgments about whether this is right or not, but they are putting this out there as a requirement so that they can make sure that employers are following the protocols to see if we can defeat this variant by making sure that people are either vaccinated and they're testing negative. So those are the issues that we're dealing with, right? So there is no alternative anymore. If you're not keeping good documentation, you are setting yourself up. And so I've got something for you because of that. Because there is no alternative, okay, just remember Tina's picture. If you ever are hesitant about doing something here, we are giving you an unbelievable amount of documentation that you need to have. Now, you can get this documentation, which includes some new updated COVID-19 policies because of some of these new rules that are out there. We're giving you a vaccine declination form that you absolutely need for your employees, and all of you have them. There's not one practice that I've spoken to, I think, in the last, month that doesn't have at least one or more employees who are refusing to take the vaccine. So there's very specific documentation for that. So there's two ways you can get them. One is you can text the word vaccines, right, to the number 44222, so you can get it that way. For those of you who have a phone handy, just take a picture of that code there in front of you, and then you will get that in your email as well. So most of you are familiar with how to do that. So just take a picture there and scan that, and then you should be able to get it. We'll have it later as well for most of you. All right, so let's jump into the mandate, right? Let's jump into the mandate. So what what are these mandates really all about? And this is a trend that we're seeing across the states. And there's a bill right now, even in Sacramento. We're not sure it's going to get passed in time, but there's a bill as we speak in Sacramento that is, that's being passed around, that may require all employers, not just healthcare, but all employers, to ensure that their employees are vaccinated. And so there's changes in the work. So this is a very fluid kind of situation, and states are passing these rules left and right. So right now, California, Washington, Maine, I'm going to show you guys a chart soon, have a lot of different rules, and then there's 15 other states that have policies regarding COVID and their employees who work for the state, and those states are passing their own rules as well. So for those of you in California, and I know a lot of you are here, I'm going to talk about a couple of the rules in a second, and then we're going to talk about some of the other states as well before we get into sort of some of the more frequent questions that we're getting. But in essence, some of the basic stuff that you need to know is that someone is considered fully vaccinated for COVID-19 2 weeks after they've completed their second dose or their final dose of the vaccine. Okay, so that's very important to know for all of you, because there are requirements in terms of getting compliant with this. The dates of compliance are vary state to state. Many states are this month in August. Some are in September. Some of the local municipalities, Denver, Washington D.C., Los Angeles, San Francisco, have their own dates and their own rules. So if you are in any of those cities, please, look at those rules specifically. We're not going to go into the specific city rules because there's just, too many of them. But if you call HR for Health, they will definitely help you. They will definitely help you navigate that, because it is kind of hard. Okay. So now what we're expecting to happen moving forward is very simply something that I think all of us expect, considering what's happening now, which is that as the FDA has approved the Pfizer vaccine, that more and more states and cities are going to have their own rules regarding this. So the counties here where I am in the Bay Area are talking about following, the recommendations of San Francisco. Same thing is happening in other parts of the state, and I'm sure, in Washington, in Colorado, and other parts of the country, we're going to see similar types of things. So it's very important to keep an eye on this. So here's a chart we've created, for the states that we know as of today, because Illinois just passed their rules, regarding what you're required to do. And I want to clarify some things out there, because there are a lot of message boards that are giving some not necessarily great information on Facebook and other things. And so it's always good to go to the source. And so here's really the nitty gritty, right? There were two kind of orders, or really three orders, but two different dates of orders that came out here in California. So there was the July 26th one that does apply to dentists. It doesn't apply to optometrists. It doesn't apply to veterinarians, but dentists and physicians, it applies to you. And then there were two kind of orders that came out on August 5th. And those don't apply to dentists, right? They apply to physicians, but they don't apply to dentists. They don't apply to veterinarians or optometrists. So if you're reading stuff out there regarding the California orders, as an example, and they're the August 5th orders, it's important for you not to pay attention to those, right? That does not apply to you if you're in California. You have to focus on the July 26th order. Okay, so what does the July 26th order say, right? Well, it says that everyone in a dental practice has to be vaccinated. Okay, that is clear. Or if they have an exemption, okay, then they can get tested instead of being vaccinated. Okay. Now that is very important, right, for you to know, right? That is very important to know. And actually, let me clarify that for a second, because I want to make sure we're on the same page. The vaccination, if an employee chooses to they don't want to get vaccinated, but they want to be weekly tested, the employer can agree to that, right? If the employer says you must get vaccinated, right? So there's a rule out there that they say they must, as an employee, be vaccinated, then the employee can be exempt from that rule if they have a medical, okay, if they have a medical or if they have a religious exemption, okay, a medical or religious exemption, right? Now, that exemption is from getting vaccinated, right? Not from getting tested, okay? So that is very clear, right? That is very clear, and that is our position. And we believe that that would, that is the position that the state is going to fall back on. Now the reality is that, if the testing, right? The testing, if you have an employee, for example, that refuses to get tested, then you have some options, which we're going to talk about in a second. But it's important to know that basis. Now, the reason I say that is because all of these states that you're looking at on this chart, right, are very similar to that, right? Now, some states, believe it or not, are even stricter than California. So like Washington or Oregon, their rules are different, okay, than what California's are, right? So for example, Washington says that you can only get tested, right, if you have an exemption, right? You can only get tested if you have an exemption, which is different than California, right? Different than California. So as you can see from this chart, there are significant changes, state to state and even municipality to municipality on this. But just to summarize, for those of you, it's important to know what these specific rules are. If you have questions about it, reach out to us, reach out to HR for Health and get into it. But the basis of it all is that at least in California, that they either, have to get tested or they have to be vaccinated, okay, tested or vaccinated. If you are going to, as an employer, require them to be vaccinated, then the employee can get out of that if they have an exemption for medical or religion, okay? But that does not mean that they're exempt from the testing, okay? It's just from the vaccination, not from the testing. Now, again, I'm giving you a general rule there for California. San Francisco has its own rule. LA has its own rule. Some of the other states, as I showed you in that chart, have their own rules, okay? So, but that basis is what we're frequently seeing. Okay, so let's get into some of the questions that we are getting, because this is really, where where a lot of these rules kind of apply. So the first question is, if I'm not in a state or city that is mandating vaccinations, can I require my employees to get the vaccine? Okay, so if I'm not in a state or city that's requiring these vaccines, so you're not basically on that list that I just showed. So the short answer is yes, but there are some protections in place for religion and medical exemptions, which we'll cover in a little bit, okay? But what's important to remember, right, is that, whether it's an OSHA requirement regarding mask wearing, regarding vaccinations, regarding testing, you got to follow all those policies, right? You got to follow all those policies. So these policies, if you're in a state that doesn't require it right now, okay, then you've got to be careful and you got to have vaccine policies in place in your employment manual, or separately from that, if you already have an employment manual that everyone has signed, that basically detail the requirements and the protocols for your vaccine requirement that you're putting in place. HR for Health has a ton of these vaccine policies. So if you're in one of those states, please reach out and we'll make sure to get that for you. And so if you don't have one and you're in one of those states, don't hesitate, right? Get it from HR for Health and put it into play if you're going to make it a requirement. But what's important is, like most things regarding COVID, is to be completely transparent with your team, right? To be completely transparent with your team as far as this is concerned. Okay, now let's go into employers' responsibilities. And one of the questions, we get is, okay, how do I maintain COVID-19 vaccine documentation as well as other medical and accommodation documents? How do I maintain those? What do I do? And this is something that, we've been talking about really since March of last year. But let's go through it again, because these rules are becoming very pertinent all over again with these requirements. So the vaccine status, vaccination status of your employees, you can get a copy of their vaccination records or card. But you have to remember, you have to file these separately from the rest of the personnel file, okay? So you have to keep these separate from the rest of the file and keep them in their medical records. Now, if you're doing things like, as I've mentioned, in the old-fashioned way, with paper and, cabinets and all that kind of stuff, make sure that it's in a separate cabinet under lock and key, or in at least separate folder, so that no one has access to those records along with the personnel records that may be in that same drawer. Okay, so keep those separate. Now, if you're going to get a document from the employee, from let's say their doctor's office or a pharmacist, make sure that the physician office does not give you any more information than required regarding the vaccine. So we don't want anything about underlying medical conditions. We don't want anything about anything else listed there except what their status is as far as their vaccination record. So keep that in mind. We have seen doctors' notes that talk about some other things, and that's not necessarily something that you need to do. Again, if you're an HR for Health client, you remember you can file those things safely and securely into our system. You have nothing to worry about. They can't get destroyed. They don't get they don't get lost. They don't get coffee doesn't spill on them. They're totally protected. So make sure you scan those and upload those into the system as soon as you get them from your employees. Okay. All right. Let's move to the next stage, which is testing documentation. And here, the testing is, of course, a big topic. You as an employer can use your discretion regarding how you're going to keep this record keeping. So it could be a spreadsheet, it could be some other platform that you house, this confidential information. All of that is okay. We have a template at HR for Health for test results and tracking. And so if you need that, please let us know and we'll get that for you. As I mentioned, we have a lot of documents created around this topic because it's all new to most of us, and so we need this. And so you can keep track of that through any of these platforms that we just talked about. Of course, we recommend saving these electronically and up on the cloud on our system so that it's safe, but you can save it really anywhere as long as it's protected and not open for everyone to see. Okay. Remember, they have to be easily accessible so that you can respond to any local Department of Health that may request it. We're not seeing that just yet, which is good news, but we are anticipating that this could definitely occur. Okay. All right. Next question is, who handles the expense for an employee who is being tested? This is a hot topic, right? This is an absolute hot topic. Now, we don't have 100% answer to this. We're still waiting from a response from the EDD and the state of California on this topic, which we think will be adopted everywhere. But we are 99% sure that the responsibility is going to fall on the employer, as many of you probably assume. And this is something that's not a sort of a flimsy assumption. This is an assumption that is pretty strong here in California based on sort of other things that we see, employers being responsible for, even with things like hepatitis B and other things that happen in an office, with, let's say, needle punctures or whatnot. Typically the employer is paying for those testings and those and the employee being out of the office to get tested. And so we think that's going to carry over here. Okay, we think that's going to carry over here as well. Now there are some things you can do to minimize, the cost of testing. Of course, the employee, would have to, travel potentially and get tested somewhere. So there's a lot of local places that are doing free testing now if you want them to leave the office, but you are paying them, of course, for travel. So that's an issue. You can have in-office tests, which we'll talk about in a second as well. And you can also have a different rate of pay for the testing, similar to sort of out, if they're doing something, like if you guys are, going to a CDA Presents, there might be a different rate of pay for them being out of the office, attending seminars and things of that nature. So those things are ways of minimizing it, but of course you can also do in-office testing too. So just kind of think about that. Now, the time for them to, where they go get tested needs to be tracked. Okay, it needs to be tracked. It needs to be tracked well. And HR for Health's time clock is the only time clock out there that allows you to track two different rates of pay along the lines that we're talking about here. So none of the practice management ones, none of the payroll ones, none of them do that. And so we created this specifically because this is, big dollars potentially if someone needs to be tested, every day or every week, for maybe the rest of the year or who knows how long, because they don't want to be vaccinated, then this could definitely add up, especially if you're thinking, they have to travel, they have to come back to the office, and so on and so forth. So keep that in mind. All right. What tests are appropriate to use in office versus out of office? Well, as I mentioned, there's a lot of counties and out of office options. A lot of counties do testing for free, especially if they have if the employees have medical insurance. The test results right now are coming back anywhere from 1 to 5 days. So which is fantastic. There's other ones that are not county based. The CVSs and drugstores and other places have them, of course. And then there's sort of the in-office tests as well, and those requirements are the same as long as they are a PCR or antigen test that's authorized for emergency use by the CDC and the FDA. You can use those as part of your in-office testing. So just kind of keep that in mind. A lot of people are doing that, buying them and doing it before the shift starts in the morning. Okay. So who handles the expense for an employee being tested? I think we talked about that. Okay, let's go to the next one, which is termination and accommodations. All right, so here we're getting to sort of some of the nitty-gritty that most of you are facing right now. What do I do if an employee refuses to get the vaccine? Okay, what do they do if they refuse to get the vaccine? Now, this is a very common thing. So when an employee refuses, the vaccine, we recommend that you engage them in a conversation to better understand their concerns and try to see if there's a qualifying accommodation that may be needed. Now, my experience, and probably the experience of a lot of you, is that this is not something that you're going to be able to change their mind on. As I mentioned, whether they have gotten COVID and maybe are embarrassed by it, and so they don't want to tell you, that they've had it, but they refuse to take the vaccine. Whether it's a political or personal reason for not getting the vaccine, sometimes these are really kind of firm, feelings that people have, and so you may or may not be able to convince them to change. And so you do have to go through this sort of accommodation kind of conversation with them. And so there's a couple of things to keep in mind. They may have an exemption. The exemption would either be a medical/disability exemption, where they need to get a doctor's note qualifying them for that. And the second is a religious reason. Okay, and so if it's a religious reason, our recommendation is that you not challenge that. If it's firmly believed by them. I know some of you may have your suspicions that it's not firmly believed for a variety of reasons, and you may be right, you may be wrong. But as far as the law is concerned, if they have a medical or if they have a religious reason, it's important to take those at face value. Make sure you have the documentation that shows that, store that, and then kind of go from there. Now, if they don't have a medical/disability exemption, they don't have a religious exemption, it's just a personal reason, okay, then that it's important to, in our opinion, to have better lines of communication with them to really discuss the specifics as to why their anxiety is at the level it is. We have seen people with personal reasons change their mind regarding the vaccinations because they were afraid of getting COVID because of protocols in the office from patients and things of that nature, and the doctor has been able to alleviate some of those fears. And so that is an option there. Now, most cities, most state orders allow for weekly testing for unvaccinated employees. So there is that option, and so that's something important to keep in mind as well. It's important to remember one thing though: the religious and medical exemptions do not apply to testing. I said that in the beginning, and I want to make sure everyone understands that. It does not apply to testing, okay? So if they refuse to be vaccinated and they have, let's say, an exemption, they are then required to be tested, right? If they refuse to be tested as well for a variety of reasons, then you have some options. We don't recommend termination, although I know it's maybe upsetting for many of you and you would want to do that. We're not recommending terminations. We think that will increase your legal risks. Although, we think you would have a strong position for letting someone go for a variety of reasons that I won't go into right now. But we think you would have strong defense, but the expense of going through the legal kind of process may not be worth it. The second thing is the second reason is because we are hoping that at some point these employees do come back to work, right? We're hoping that they do come back to work. So we're not recommending terminations for those two reasons. And whether that they change their mind and they agree to get tested or whatnot, hopefully that happens. But just remember, if you want to terminate them, make sure you talk to a healthcare attorney so that they can coach you through it. But we're not recommending that. But you can require them to get tested if they're refusing to get vaccinated and they have a medical exemption. Okay. All right. How do I navigate the medical and religious exemption request process? So let's talk about a little bit about that. So a couple of things. This is part of some of the documents that we are giving you. So I'm going to build on what I just talked about. So if they are refusing the vaccine due to a qualifying disability or religious reason, you have to follow the interactive process like we talked about. So step one for the medical is the employee has to complete the vaccine declination form, saying that they're declining the vaccine, right? So that's part of the documents that we gave you early on today, right? So that form needs to be completed, okay? So we have that form. We've drafted one for you. It's a great form. It's an easy to fill out, and so that you need to do, right? Step two, the employee has to provide a medical documentation from their doctor, their primary care physician, or someone similar to support the need for the reasonable accommodation having to do with the vaccine. Okay, so those two things are very, very important to get if they are asking for a medical or disability exemption, okay, or accommodation, right? Now, some of you have asked this question, what if they refuse to sign the declination form? Well, if that's the case, my recommendation would be for you to write there that the employee refused to sign and have the employee just initial that they refuse to sign. There's no harm in that, and it's good for the employee and it's good for you. So just handwrite that, and then remember to make sure you are putting it into HR for Health. Okay. All right. I think something happened to the slides. Okay, there we go. So that's for the disability one. For the religious exemption, you also have to have them, step one is you also have to have them sign the vaccine declination form saying that they're declining it for religious reasons. And then getting the documentation that shows, right, that they have a religious exemption. So now what documentation is there, right? So well, there isn't one, generally speaking, right? So there isn't one, generally speaking. Now there are groups that are giving some of these forms, at a certain dollar amount and all this kind of crazy stuff. But generally, you should assume if the employee is saying that they have a religious accommodation, that is a sincerely held religious belief. And if you are questioning that sincerity, then you might be able to be justified in asking for additional information. But you just have to be careful, right? You just have to be careful about that, because that could easily happen. Okay, so just keep that in mind. Remember, again, we highly recommend that you do not terminate employees for either one of these because of the additional risk that could come upon you. All right. So let's go to the next question, which is, what if my practice can't afford to make an accommodation to these employees? Okay. So if an accommodation isn't possible, you do have some options, right? So you can do an unpaid leave of absence for the employee, or you can furlough them. I know that's like a dirty word, right these days. If you remember from March, April of last year, furlough was like thrown around like no other. But anyhow, but those are options you have, right? Those are options you have: an unpaid leave of absence, or you can furlough them. With a furlough, if you guys remember, the employee is not terminated, right? They're still part of your team, but they're simply just not working during the duration of the furlough. Now, Now, because this isn't March of 2020, some of the rules have gone back to what they were before. And so there is an argument to be made that if someone is furloughed for 2 or more weeks, that they have been terminated. So there is some sort of ambiguity there right now. So we don't know exactly where that's going to fall, but just kind of keep that in mind. Okay. But what's important is to make sure that you act consistent with your decisions across the board with all employees. Okay. So don't pick and choose who you do things with, who you furlough and who you don't, who you make an exception for. You should be really, really consistent with that, as it will serve you better long term with all of your team members, okay, with all of your team members for a variety of reasons, right? For a variety of reasons. Now, I know some of the questions we're going to get, and some of you feel very strongly about these, which is, well, why can't I fire them, and why shouldn't I fire them? And I want you to know, as a lawyer, right, if I put my lawyer hat on, for a second, I'm not saying that you will lose a case if you fire someone who didn't, who refused to be tested and refused the vaccine and just kind of refuses everything. Not saying you're going to lose. In fact, we're very aggressive on that front, and probably would be very successful, as we have done on numerous occasions this past year. But the question is not whether you will succeed at the end. The question is it worth the financial investment to go through that to then be proven right at the end? Okay, so that's the real question, and my job is to make sure we avoid those kinds of things. If you are involved in it, of course we'll defend you, and of course we'll be very aggressive, and the likelihood of success is strong. But is it worth it? Right? Is it worth it? Prevention is the key, right? It's the reason why we created HR for Health, right? Prevention is the key. Prevention is the key. And so just kind of think about that. But if you really feel strongly about letting them go, call someone like me, and we can kind of walk you through it. All right, let's go to the next question. Can I require the COVID-19 vaccination as a condition of employment? Now, many of you are hiring people to replace others, or, because your practice is growing and you need more employees. And so the question of, can you require it? The answer to that is yes, but it's a timing issue. Okay. It's a timing issue. Now, for most of you in the dental healthcare field, you can say that it is irrelevant to your job, to the job, because of course, whether they're in the back or in the front or anywhere, they're required to have it based on the state order. But consistency is key. So what we're recommending is that you go through your normal interview process, okay? You go through that, you select the employees that you want to hire, okay? And then once you hire them, right? Once you hire them, then what you will do is you can make it as a condition of their employment, okay? So just like you may have drug testing or background checks or those kinds of things, then you put it in there as a condition that they have to show that they are, vaccinated, if that's what you choose to do. And that's okay, right? That's okay, because you've already made the decision, and then this is just a condition of their employment. Okay, so that is our recommendation. Now, for your current employees, right? During your current employees, we do think that you want to be really consistent with them. If you're going to make this about them, asking them about their vaccination status, you got to be very clear. Are you mandating it or not? Are you asking about it or not? Are you going to make it a requirement? Try not to ask a ton of follow-up questions as to why, and those kind of things, because it might go into the ADA requirements. So it's important to sort of be careful about with it with regard to your current employees. But for new employees, it's a lot easier to do that, especially as you're hiring new people. Okay, so just kind of keep that in mind. For your current employees, there could be accommodation requests and things that come out of it. So again, can be tricky. All right, so let's talk about next steps. This is really important. If you have your phones, get ready to take a picture, not of me, but of the slide, so that you have sort of a homework of things to do to be compliant. Of course, all these we can provide for you as well. So you want to establish the following, and this is super, super important to do these, right? So one is, you want a COVID-19 vaccination policy Even if you're not requiring it for your team members, you've got to have a policy in place. Okay, you've got to have a policy in place. So this can be a standalone. It should be a standalone policy from your employment manual for now. For next year, of course, or if you're getting if you're an HR for Health customer, when you get your new manuals in January, make sure this will definitely be in there. So, but for now, make sure you get yourself a policy. You want to get the declination form, as we talked about tonight on a couple of different occasions. It's really, really important to have that declination form signed for anyone who doesn't want the vaccine or if they refuse to be tested. You got to have a good system and protocol for the religious and medical exemptions. Okay, so make sure you have that as well, and make sure you follow those. Documentation protocols for test results and vaccine. What are you going to do when they send you that stuff? Are you going to keep it on your phone? The answer is no, by the way, right? What are you going to do with that? If they text you a picture of their negative test and things of that nature, where are you going to put it? How are you going to upload it? Where are you going to save it? Do not keep it on your phones or other non compliant protocols. Either print them out, put them in a file, as we talked about, under lock and key, or ideally, you put it into HR for Health. So keep that in mind. Hiring protocols for conditions of employment, right? So remember that as you're hiring new people, as difficult as it is, right? As difficult as it is to hire people right now, when you do hire them, make sure that is part of the offer letter as a condition of employment, and not something that you talk about, before, during the interview process or whatnot. Keep those two things separate. Okay, keep those two things separate, and then communicate with your team. Right, hugely important that you communicate with your team. This is difficult for everybody. It's difficult for you. It's difficult for her. It's a tough time for everybody, and so communicate with them. Tell them what you're planning on doing. And help them kind of navigate this along. Remember, there are very few people who are refusing all of this just to be difficult. Okay, they have beliefs in place. Whether you agree with those beliefs or not is a totally separate conversation, but they have beliefs in place. You may not, you may or may not give those high regard, but the reality is that you need to follow those protocols, right? You need to follow the protocols, and there are alternatives, right? Some cities like San Francisco, LA, have made it very difficult for someone not to get the vaccine and still work in a dental practice. That's just the way those cities are. The state right now is making it a little bit more relaxed, because if they don't want to get the vaccine, they can, get tested as an alternative. So it's a little bit easier. Some other states outside of California, even that's been a little bit more difficult. So you just have to be aware, right? You just have to be aware of the rules, and then you have to communicate with your team and let this, kind of happen. When will this end? Who knows, right? In March, April of last year, when we got that question, when will COVID end and when will we be back in the office? We all thought it was going to be, a few months. We're obviously way past that, and who knows what the future will bring. But we know these rules are in place, and as you saw from the Tina picture, there is no alternative, right? There is no alternative. You have to follow these protocols right now. The safety of your office is in jeopardy. HR for Health is here to support you throughout all of this. Of course, we've got the handbooks. We've got the documentation that you need. We've got a time clock that is the best in the system. It's an incredible what our time clock can do with benefits and tracking and whatnot. It's always under, it's one of those things that people kind of, look past because they're so used to the practice management time clock or some ridiculous thing that they're using. But this thing is the best in the system. Performance management tools, HR support, of course. Our team are rock stars. We've got lawyers, we've got HR professionals. They're all there to help you answer questions. And then, of course, we've got our payroll and 401k product as well. So let us help you navigate through this craziness. We know it's crazy. All right, one last time. If you need these forms that we've been talking about tonight, don't hesitate to use this, right? You got the QR code there. Take a picture of it. You'll get it in your email there. If you want, you can text the word vaccines to that phone number, 44222, and we'll email that to you directly as well. So you have all of those forms. But I want to thank you all for being here tonight. If you want to learn more about HR for Health, please go to this website, hrforhealth.com/schedule, and one of our team members will show you around, and more importantly, talk to you about your specific situation. If we did not cover your state-specific rules, or if I confused you more about your state-specific rules, please call us and we will walk you through it, right? That's what we're here for. Our entire company is focused on helping you navigate this whole thing. And so let us do that for you. But be patient, right? Be patient. We're getting thousands of calls nationwide, right? Like literally thousands of calls every day nationwide. So be patient with us, but we will make sure we get this, information to you. All right, Kim, I'm sure we've got tons of questions. What can we talk about?
We do, Ali. My goodness, we have more questions. We've done so many of these, right? More questions than I've ever seen.
Oh no, okay.
But we're just gonna do a couple that seem, we didn't quite cover. So let's see. Number one, only a couple of our current staff are vaccinated. Can we require that all new hires be vaccinated, even though current hires are not?
Yeah, great question. So with new hires, you can. Remember what we talked about. As long as you follow that protocol, the answer is yes. You kind of handle kind of the groups slightly differently, right? Your new hires, you can't ask those questions, or not those questions, but you can make those requirements. For your current team, you want to be careful, how you handle the fact that they're not, vaccinated. Make sure they're getting tested and things of that nature. What I see as a problem would be is if you required your new hires to be vaccinated, but then, allowed your team to not be vaccinated and also not get tested. Okay, then I think there could be some problems there.
Okay. Great. Do the employees have a choice between vaccines or testing in the state of California? Specifically, we have an employee who is refusing to get vaccinated.
Yes. So let's go through that again. So in the state of California, assuming you're not in San Francisco and you're not in Los Angeles, the employees do have that choice. So it's a matter of either getting tested or getting the vaccine. If someone is not vaccinated, okay, if they're not vaccinated, and then they can get tested as an alternative, okay, as an alternative. Now, if you as the employer, right, are requiring the employee to get the vaccine, you have to be aware of the exemptions that we talked about, the religious one and the medical one. Okay. But yes, so I think that answers the question.
Okay. Any concerns with the dental office performing the weekly COVID antigen test in office?
No, as long as you're using the right test mechanism that we've talked about, you should be fine. Yeah.
Okay. Yeah. Do we need to retain copies of weekly tests?
Yes.
Great. All right, this is going to be the last one for tonight. What is the other option if an employee refuses to be tested? You said no termination.
Ask that question again, Kim.
Okay, what is the other option? I'm assuming what is another option if an employee refuses to be tested? We believe that you said that you can or should not terminate. So what's another option?
Yeah, it would be unpaid leave, right? It would be unpaid leave until they either decide to get the vaccine, until they decide to get tested, or COVID ends. so one of those things. Yeah, so it's either unpaid leave, which probably is the only option for someone who's refusing the vaccine, refusing to be tested. You really don't have a choice in that situation if you're here in the state of California. In some other states, it's even a little bit more strict. So.
Okay. All right. Well, as I said, we got tons and tons of questions. We will do our best to be following up with you, with everybody. There's also a lot of questions that are going to have to be state specific. So when we follow up with you, we'll get more information about where the question is in the country, and that will help us to answer it. So thank you so much, Ali. Thank you everybody for tuning in. And we will see you, we'll see you soon, it sounds like, based on
All right.
everything that's
Thank you,
going on in
everyone.
the world. Okay, thanks.
Thank you, everyone. Good night. Be safe.